Dear students, let us solve an image-based question in the upper limb. Observe this figure. Identify the region of the upper limb, the side of the upper limb, whether it is the anterior surface or posterior surface. Get familiar with the region. Then answer the questions. The first question is, you have to identify the muscles numbered 1 to 6, and you have to name those muscles and give their nerve supply. Then the second question is, because they are all the muscles that were pointed out, majority of these muscles are supplied by branches from which cord of brachial plexus? You have to answer for that question. Then which of these nerves is included in the Eps point? So these are the questions you have to answer. Now look at the region and answer the questions. So this is the back of scapular region. So the posterior aspect of the upper limb. And then now focus on the muscles that are to be identified and their nerve supply has to be given. So the first one, what is this muscle? So it is the deltoid muscle and it is supplied by axillary nerve. Then the second one, what was the muscle? It is the teres major muscle and supplied by lower subscapular nerve. The third one is the long head of the triceps muscle supplied by radial nerve. Then coming to the fourth one, it is the teres minor muscle, again supplied by axillary nerve. And all of you know that axillary nerve supplies two muscles, that is the deltoid and teres minor. Then coming to the fifth one, it's the muscle in the dorsal aspect of scapula. And what is this muscle? It is the infraspinatus muscle supplied by suprascapular nerve. Then coming to the sixth one, it is the supraspinatus muscle supplied by suprascapular nerve. So now you could answer the 6 muscles and their nerve supply. And if you go through those nerve supply of these muscles, so majority are derived from the posterior cord of brachial plexus. Here you have to recollect the branches from the posterior cord of brachial plexus, which you remember the mnemonic stars. So upper and lower subscapular nerves, the thoracodorsal nerve, the axillary and radial nerves. So the 4 of these muscles are supplied by the branches from the posterior cord. So that is the answer for the second part of the question. And regarding the third part of the question, which of these will contribute for the Eps point? So meeting point of 6 nerves, you know, and 2 of them are the roots and 2 of them are the divisions and 2 of them are the nerves. So what are those 2 nerves? They are the suprascapular nerve and the nerve to subclavius. So here the suprascapular nerve contributes for the Eps point. So you could answer the 3 components of this image-based question. Now let us see another component of this image-based question, and in this a rectangular area was marked. Okay, so focus on this area. So you have to name this space and what are its boundaries and contents. You have to also mention the side and view of the limb. So what you are seeing, that rectangular area, you have to name it. So it's a quadrangular space. So one of the intermuscular spaces in the back and scapular region. So where you will find the quadrangular space, upper and lower triangular spaces. Then the other spaces which you will find under the intermuscular spaces in the back and scapular region are the triangle of facilitation and lumbar triangle of Petit. So what we are seeing now is the quadrangular space. So which side of the limb? So it is the right side limb. And then what view we are seeing is the posterior aspect. It is the scapula, the dorsal surface you are seeing, and then the part of humerus you are seeing. Then what are the boundaries for this space? So let us revise what we have seen in the previous answers for the question. So above is the teres minor muscle. Then what about inferiorly is the teres major muscle we are seeing. Then what is the medial boundary is the long head of triceps we are seeing. Then what is the other landmark is the laterally is the surgical neck of humerus. So these are the boundaries for the quadrangular space. Then what are the contents of the space? So you are seeing the two contents. So what are they? They are the axillary nerve and posterior circumflex humeral artery you are seeing. So the contents of this space are axillary nerve and posterior circumflex humeral vessels. But in this picture, an artery is drawn here. So what you have learnt in this picture is the boundaries and contents of the quadrangular space, because it is having an important content, axillary nerve, that has got lot of clinical importance. In this image based session, you have learnt about the important muscles, that is the deltoid muscle, and then you have learnt about the muscles of rotator cuff. Recollect them. They can be remembered as seats: supraspinatus, infraspinatus, teres minor and subscapularis. Though you have not seen subscapularis here. One word about subscapularis is it forms a boundary, that is the superior boundary for the quadrangular space anteriorly, because you have seen it on the posterior aspect. From the posterior aspect you are seeing the teres minor muscle. So the upper boundary for the quadrangular space is subscapularis anteriorly and teres minor posteriorly. And you have learnt about the course of the axillary nerve. Part of it will be through the quadrangular space, and the important relation of this quadrangular space, the boundary, that is the lateral boundary, is the surgical neck of humerus, that is having clinical importance. Hope this is of use for you for understanding the certain of the structures.